Thank you so much. I am really thrilled to be here. I'm sorry I can't be there in person, but I'm glad you are all there in person, and I hope it's a wonderful day. I am a professor of economics at Brown, and I am really driven by data. And so what I want to talk about today is a little bit of what we've seen from data in the pandemic, what we know and what we don't. And I spent a lot of the time in the pandemic either collecting data or bemoaning that others had not collected it. And I think that now we have some, and it helps us understand what happened and what's happened in the pandemic, but also what we're likely to see as consequences going forward. I think the data helps us understand, although I think it is very sobering. So I want to talk a little bit about sort of some of what we've seen in the pandemic policy picture in terms of what kind of impacts there have been, and then a little bit about at the end about sort of what I think is going on with kids. So for me, the kind of most central fact about the pandemic data is that, or the pandemic experience, is that it exacerbated existing inequalities in ways that I think we are only just beginning to really grapple with. So let me give you a few examples of that. So the first is in labor force participation. Already today, you talked a little bit about the issues that already arose in women returning to the workforce or women going to school because there is limited childcare. That has only been more true during the period of the pandemic in which childcare was less available, in which school was less available. We saw big drops in women's labor force participation in March of 2020, and those have not recovered. And in particular, over the last school year, they didn't recover at the same rate that men did. And that is likely because of a lot of the continued needs for caregiving in the household for kids who had either no school or disrupted school or childcare that was not available. That inequality across genders and across race was already there. Those were already issues that we had. This made it worse. And it also made it more salient, it made it more visible. Another example is schools, and in particular, sort of schools and kids' performance in school. There were already pre-pandemic large gaps across racial and income groups in test scores. School districts with more Black students and Hispanic students, more students eligible for free and reduced price lunch, they already had lower test scores to begin with. And they were also less likely to open for in-person learning during the pandemic. So even if you look within a location, certainly if you look across the US, but even within small areas, districts with more vulnerable students were less likely to offer in-person learning. We have been doing some work looking at the relationship between school closures and test score losses over the pandemic year. One of the things that we find is that if you move from fully in-person to fully virtual learning, even looking within a small area, even looking within, say, a commuting zone, so that's a pretty small area, moving from all in-person to all virtual is about a 13 percentage point increase in the losses during the pandemic. So those fully virtual districts had a 13 percentage point larger drop in their pass rates on proficiency tests over the pandemic year. That's a really large change. It's vastly larger than we would typically see than the kinds of variations we'd see year on year. So we see that as a result of school disruptions. And we see that these districts with more vulnerable students are having more disruptions. And beyond that, we also see that the impact of having disrupted school is larger for the districts with more vulnerable students. So in a sense, these students are less likely to have access to in-person learning, and they were more affected by that lack of access, likely because of more limited resources, of more disrupted family lives. The losses were bigger for many reasons. Again, losses, inequalities that were there before they got exacerbated by the pandemic. And of course, the most salient example of this is the pandemic itself, is the health impacts of COVID. There already are large health inequalities across the US. These inequalities got worse during the pandemic. the pandemic disproportionately has affected communities of color, has affected low-income communities. Some of that is because of differences in exposure. Some of that is because of differences in pre-existing health conditions, but all of those things were true before. Those populations are more likely to suffer from heart disease, from cancer, from diabetes. Now they're also more likely to suffer from COVID. It's adding on, but it's not different in terms of its overall impacts and its overall inequality across these groups. So I think recognizing that, sort of looking out at this landscape and seeing, we see enormous disparate impacts of the pandemic on all of these different dimensions in the data. That is what we see in the data. Can we then use what we have learned? Can we use the data to address some of these things, to try to ameliorate some of the losses in the pandemic, but also to get back to a better place than we were before? And that, to me, is the most significant challenge here, is to say, look, the pandemic made clear some inequalities that we shouldn't have been okay with before the pandemic. We shouldn't have been okay with these inequalities in access to childcare. We shouldn't have been okay with these inequalities in test scores. Now we see them. Now we have some resources and some motivation to put time into this, and that is something that is something we should be able to do, and I hope that we will do. Let me then say one sort of close with something about the issue of children and of the impacts of the pandemic on kids. When the pandemic started, it actually became fairly quickly clear that children were quite low risk for serious illness from COVID. I remember that my children's school told them that as early as March of 2020. Before anything locked down, they got a little pamphlet about how, we are worried about older people, but you're gonna be okay. This remains true. Younger kids under 5 still cannot be vaccinated. And that is unfortunate. And it is something where I wish that the FDA was moving faster. And I know I'm not alone in that. But despite that, for the most part, the risk for most kids, the risk for serious illness from COVID or of long COVID is still vastly smaller than their vaccinated parents, and certainly than their vaccinated grandparents. And during the pandemic, I got a lot of heat for saying that. But the reality is that when you look at the data, that is what shows up. Doesn't mean that kids cannot get seriously ill from COVID, or that we should not think about this or be cautious about it in various ways. But it does mean that relative to the kinds of risks that we saw in say older adults, the risks associated with this in kids are much closer. In fact, in some cases, much below what we see as risk for other standard childhood illnesses that we experience, like RSV or the flu. Despite this, our kids have borne an enormous brunt of the pandemic. They have experienced tremendous disruptions in their lives. We've seen spikes in mental health issues for kids, including young kids, including ER visits for self-harm among 10-year-olds, among 11-year-olds, among much younger kids than we would have seen for those earlier. We're starting to see some evidence of speech delays in younger kids, some evidence of just disrupted socialization, of disrupted socio-emotional learning. We hear from teachers, we hear from childcare providers that kids are really, in many cases, suffering. And again, the suffering, I think, has a significant inequality across populations. The freedom that has come for many people with vaccine approval, just the practical freedom, has been continually delayed for youngest children. And we're seeing places like New York where the only people who are still masking are toddlers, even though that is the group who has the probably lowest benefit from continuing to mask and the highest costs. So it seems to me that sort of looking back at this, throughout this entire period, we have really put the needs of kids, and to a lesser extent, but still very much the needs of parents, very, very low on our list. We talk a lot about the resilience of kids. They are resilient, but we see in the data that they are also suffering. So I think the challenge for the next years, for the next decades, is to think about how we can use the data, how we can use this evidence to try to address some of these issues, to try to help our kids recover, and to try to help to get them on the best path to have the lives that we know that they can. So I'll stop there. Thank you.